Joining us now to take a look at this is Gerard Van Mourik. He is an expert in refugee crisis in Nigeria. Thank you very much for joining us. With Africa's COVID-19 cases surpassing 3 million, how would you say Africa is faring in fighting the COVID-19?
Africa is faring very well. Thank you for having me on our show. Can you hear me?
Yes, I can. Go ahead.
Yes, Africa is faring very well, much better than Europe, America, or any other country in the world. Zooming in Nigeria, you have won international awards for beating Ebola, for beating polio, and I'm sure you get international awards for beating COVID too. But it requires more determination. I'm not saying more funding because Nigeria is very rich. You have a lot of money to spend, and it requires government determination and decision to make available sufficient vaccines for the entire population, to start with health workers, those on the front line, and other vulnerable people, notably internally displaced people and refugees, for example, in the Northeast. That is, or that should be, a priority.
I want to go back to your comment about, faring well. There's been a second wave, and you know that even during the first wave, when we had high figures, the figures we're getting now is much more than the figures we got during the first wave. Isn't that something of a bother, and doesn't it indicate a deeper problem that we might be missing?
Yeah, I see where you're coming from, but I'm not a medical doctor. I'm definitely not a virologist. I'm not the president of Nigeria, but if I were the president of Nigeria, I would not sleep easily. There is definitely a risk to have this pandemic spinning out of control in Nigeria, as it does in other countries, here in Holland, the rest of Europe, and the United States notably. But yes, you are faring much better than European countries or the Americas, much, much better. But you need to stay in control. You've been beating Ebola, you've been beating polio. I wouldn't know why you would not be able to beat COVID too.
Okay, so what would be your appraisal of Nigeria government's efforts regarding the acquisition of COVID-19 vaccines so far?
I would not solely depend on COVAX facilities. I would not solely depend on other procurements solely. But I would be strategic, and as our governments here in Europe have been strategic, to buy vaccines, to procure vaccines, to negotiate best prices, and to make sure that you get started vaccination as soon as possible. I wouldn't know why we could not start vaccination in Nigeria, for example, when in fact China, India, Brazil, the United States, and Europe have already started. So make it a priority, get these vaccines in country, and start rolling out vaccination.
All right, before we let you go, just one more for the road. Let's talk about the millions of refugees scattered across northeast of Nigeria. No one is talking about how this group of people are going to be vaccinated, or if they have even been tested. What are your thoughts on this?
No, they have not been tested. I've been working in Maiduguri for the entire year, last year, coordinating, managing life-saving aid for over 600,000 IDPs and refugees in 9 camps in Banki, Monguno, Nagala, and Damasak. And I can assure you that nobody has been tested. There's no single test available, unfortunately. But as with again, I'll come back to what I said in the beginning. As you did with in a combined effort with partners for HIV, for polio, and Ebola, we must make vaccines available for the most vulnerable people in the Northeast, and to prioritize them to others.
All right. Thank you very much for joining us on the news. We appreciate your time and your thoughts.